Hi, this is Rebecca Hergert. We're going to talk about monitoring blood glucose. Mrs. Webb was kind enough to let me use her PowerPoint, so that's what you're going to be seeing. The objectives are going to be to understand the modalities for testing blood glucose, to demonstrate the procedure for monitoring blood glucose, to measure and document blood glucose, and to identify the actions to treat abnormal readings. A lot of the hands-on, of course, we're going to do in class. I'm just going to give you the basis for why we're doing what we're doing. When you test blood glucose, urine can be used. It used to be a staple for people testing their glucose at home. It was called a dipstick test. They would just pee in a little container and put a little piece of special developed paper in there, and it would tell them how much urine was in there, or how much glucose was in their urine. Not really as accurate as blood, and it's rarely used in developed countries now. Blood is a lot more accurate, and it's used much more often. In the emergency room or in the doctor's office, if they're drawing blood, if they're doing a venipuncture, they'll use that blood in order to monitor the glucose. But usually if it's just checking for glucose, people at home or before meals, just routinely checking it, they're going to use a capillary sample. It's a good sample. It gives you just as much information as a venipuncture does, and it allows the patient to monitor themselves in the home setting. Whenever you test blood, you're going to use standard precautions. You're going to observe the requirements for testing. What's the physician's order? Excuse me, how often is the patient to be testing their blood glucose? Is it to be fasting, where they've not eaten anything all night? In the morning they check it. Is it right before they eat so they can see what their blood levels are so they can adjust their insulin? Is it after meals to see how well they're getting rid of, they're using the glucose that comes in their food? Is it at bedtime? Is it random? Why are you checking this? You always want to wash your hands first to gather your equipment before you ever go into the patient's room. Glucometers and strips. There are a lot of different types of machines, but they all have some things in common. All of them require that you use a lancet to access the blood. A lancet's just a very, very fine needle. Sometimes you just take the lancet and poke your finger. Sometimes it's in a little device where you don't have to look at it. You just squeeze the trigger and it gets your finger. But they all require a lancet. They all require some type of a strip. Some you put the blood on before you put the strip in the machine. Some you put the strip in the machine, then you add the blood. You've got to kind of go with whatever your device directions are. And all of them have a testing solution so that you can make sure that your machine is still being accurate. Some machines are downloadable. Whenever they take their AccuCheck, it automatically goes to their EMR, their medication record. Some of them you have to physically write down the information, like a patient at home would maybe have to write it down in a booklet or something and then take it to the doc. Some home machines are getting rather sophisticated though. They allow you an opportunity to type in if you're under stress, or what food you just ate, or if you're not feeling well, or other information that can and does affect your blood glucose level. So you're going to have to look at what the patient's got, what type of machine they're using, if you're going to be able to instruct them on it. Some of the most common devices are One Touch and AccuCheck. AccuChecks you see in the hospital a lot of times. Things that you're going to need to gather up, take with you is, of course, the device, the alcohol wipes, the strips. Make sure the strips are not expired. The expiration date will be on the side. Your lancet and a 2x2. 2x2 is to wipe away the first drop of blood. On the PowerPoint, I have listed out for you each skill step that you're going to do and exactly why you're going to do that. I'm not going to read all those to you because you need to take the time to read them, to think about them, and to remember what you're doing and why you're doing it. Basically, you always want to make sure that you know that what you're doing is ordered. You don't want to take a blood glucose level on a patient who doesn't even have diabetes, who's not at risk for diabetes, and you just got the wrong room. So always want to use two identifiers to make sure that you've got your patient right. Wash your hands. Make sure the patient washes their hands, because you want to get if there's any soil on their hands, you don't want to get a false reading based on they just ate gummy worms. Or they just ate a popsicle. Okay, so you want to make sure their hands are clean, and then you're going to proceed with your procedure. get all your stuff together. Make sure they know what you're doing, why you're doing it. Make sure what levels you're looking for. If you're doing teaching, make sure that you teach them in a way that they're going to be able to receive it. Make sure that they've got something to refer back to.